Hi everyone, this is Dr. Erdoğan by Smile Hair Clinic. Today we would like to share you a patient that we did his operation in 2023 with 3,500. So let's check what we did for him. So he's a 43 years old Icelandic patient, and his need was primarily for the frontal part and some for the crown area. So we expected a little bit more graft number with him, but we ended up with a little lower number. Normally, we in the patients like that, we always wanted to have the maximum grafting, but with him, we did 3,000 something 500 like that. Okay, let's see his photos. This typical male pattern baldness that is more both temporal areas receded. The frontal area also lost its density. There's a transition from front to mid-skull with the lower density, and also he needed some crown as well. So we did his evaluation, we did his examination, and we decided with the hairline together. In the patients like him, which is more Nordic, more Northern Europe, and with more thinning hair, we also wanted to achieve the right density. So that's the reason, like most of the patients, I'm following this rule. We try to take the as conservative hairline as it could be, and if we decide with the patient together about that, and if he's convinced about our recommendation, we always do that. So in the frontal central part, we also keep his hairline in the same level, but for the temporal areas, we achieved a little higher, and the patient accepted, so he had a better result actually. Sometimes patients want to lower the both temporal parts, which is sometimes losing the density from the other areas. So as you see, we planned for the frontal part, we planned something for the crown area, and you can see from this top appearance, it looks like that too. Okay, so let's see his photos. I would like to show you the transplanted photos from the end of the operation. As you see, we just tried to give more density to both temporal parts, and we achieved a little bit better in the frontal part too. In the crown, we couldn't have too much graft because it was, as I told you, it's thin hair and we need to achieve the right density. So we did something less for the crown area, and that's the end result with the transplantation. So let's see his first month of photos. Okay, it looks like he still has some redness. With more blonde patients, we see a little bit more redness in the first 2 months or even third month. So it's very normal, don't worry about that. That's the only thing that it's a sign of that you had a transplantation before. So this is the third month photos. His donor area already healed, it looks very good. It's not all grafts started to be growing, some maybe, so we can't see anything in the third month. By the way, don't forget something, guys. Okay, we always say like we wanted to see the result after the initial result from the third month or fourth month, but it's not like a calendar date. Sometimes we see prolonged ones, or sometimes we see very early ones. So don't compare yourself with any guy. Everyone is different. Everyone is a different follicular unit capacity, so it could be different. So I think he didn't send us his photos until the 9th month. So I wanted to see his 9th month result. Okay, this is how he looks from front, how it looks from the side, and how it looks like in the donor area. And this is how it seems with the top. So I think he already changed a lot too, if you can see the photos and if you can see the comparison before and after. This is the true transformation that we do with each patient, and we wanted to achieve the right density for a good hairstyle in the front. Yes, he's covering his front, but I mean, if we can see from the side photos, it looks very good, nice and natural actually, and his donor area seems very good too. Even though we haven't done something on his crown area, the crown area appearance is good too. Before he applied to us, he was using some minoxidil for a few months, and he continued with the minoxidil as well. So minoxidil and finasteride is very essential for the growing of the existing hairs. also to prevent them from the future hair loss. In the total, we still see a good result with combination of medical treatment and the transplantation treatment. So thank you for watching this case with me. If you have still questions, please write on the below and we will answer them quickly. Thank you.